Welcome to the Don't Count Me Out podcast. This program is dedicated to stroke survivors, loved ones, and caregivers, medical professionals, and anyone interested in learning more about this devastating disease and the warriors that face it every day. Our mission is to share stroke survivors' stories of inspiration and hope, form friendships and community, gain knowledge and insights, and the courage to dream and explore new avenues as we find our way back to living. So, my friends, the Don't Count Me Out podcast begins right now. Our illustrious guest for today is Dr. Gopi Tejwani.
Or simply Dr. T.
Dr. T. And our other guest, just as I'm not sure if he's illustrious or infamous, but both of these men have become very good friends. And they have an awful lot to offer. The reason we're talking to Dr. T today is he came up with an idea that I think is really going to help a lot of stroke survivors, especially if you're taking medications or if you have questions in regards to having a stroke. A lot of the people that see him on our page don't realize how much education this man has. So when he's talking to us, we can listen to him. Dr. T, why don't you give us a little bit of your background? How did you start? How did you get into medicine? How did you come from India to America?
Let's start with the history. How did I come to America? You had to go all the way to 1947 when India was divided in the two parts, India and Pakistan. And our parents being Hindus, they decided to come to present India. So basically, I grew up in a refugee camp. But by the way, I am writing another book on life of a refugee. Being a grown up in the refugee, basically you don't know what is going to happen, what could be life. I mean, there is no electricity, there is no running water, there are no toilet facilities. You have to take a bath outside in the village. Everybody is looking at you. You are taking a bath. So that atmosphere I grew up. And only when I came to college, that too also in the final year of college, I started staying in a hostel. So I had it, and also during the partition, my mother became sick, and in a refugee colony, there were no facilities, and she died. So I grew up since 2 year old without mother. Initially, my sister helped me, but she got married when I was 9. 7 years she helped me, but then she got married. So we have been cooking and cleaning and doing everything, and plus studying. So that's the background. When I was 10-year-old, my old brother showed me an American magazine called McCall's. McCall's was a very glossy magazine. There were advertisements about vacuum cleaners and carpets, and the rooms were full of carpets. And I was very surprised that a life can exist, that you can have a carpet in the house. I could never even imagine, because we had like a mud house, and if it rains a few inches, the water will come inside the house. So we cannot believe that there can be, So anyway, that was the first motivation to come to America. And then, of course, being from poor family, I cannot just tell my father to give me money, I'll go to America. I had to do myself. And then I realized that maybe education is the only way. You have to come up and do MSc, PhD, and some other things. Then only maybe America will invite you. Otherwise, you cannot come. So I started concentrating on studying and did my PhD. And during PhD in New Delhi, I realized that most of the good chemicals we were importing from America. So there was another thing, oh my God, America is helping me in my education. I had to buy a lot of chemicals from, there is a company called Sigma Chemical Company, which was in St. Louis. So then again, I was impressed with America. And the final impression came when in 1969, America sent a man to moon. I said, how can anybody go to moon? That was like for me, the people who can think that high, I want to be in that country. So all these things, had an impression, and we were publishing the research papers in American journals. So American people were familiar with my research. So as soon as I got PhD, they invite to do further research with my it's called postdoctoral fellowship. They gave me money and everything. I think I came to St. Louis in 1973, about 49 years back. I had a good life in the sense that after 3 years of initial training, Ohio State University offered me faculty position in 1976. So life was going hunky-dory till 2008 when the stroke came. A stroke came to me out of nowhere. I'm sure that most of the people, it happens, it comes out of nowhere.
Mhm.
But in my case, I don't even have any pre-diseases like diabetes or high blood pressure or stress. I mean, I was stress-free, enjoying my life, teaching. When I see students, I feel very happy. So it was a funny thing that the stroke came to me, and then a doctor told me that in my brain stem an AVM burst. AVM is a arteriovenous malformation. So there's a connection between veins and arteries. It just got lost. It got busted. If it bursts, then a lot of blood comes out in the brain, and which is suffocates the brain, and then you lose the lot of problems. So my right side of body was paralyzed. I went to the hospital and they divide me and they let my brain be anesthetized and get rest for about 2 weeks. So I was in coma for about 2 weeks in my hospital emergency room and rehabilitation hospital. I was 6 weeks, and nobody knew that my wife was told maybe if he gets up from coma, it will be good, but it's possible also we cannot do anything because the stroke is in such an area where we do anything, he may stop breathing, his heart may be collapsed, or he may simply die. So we are going to keep him on the mercy of God.
Doctor, how long ago was your stroke?
The next month, October, it will be 14 years, October 2008. 3 months after the stroke, they stabilized my connection by giving what they call gamma knife radiation. So it's a specific radiation in the area of the brain which promotes the blood vessel development. So it kind of now AVM is corrected now. Everything is fine. Last conversation I had with my neurosurgeon, he told me, you are fine, you are as normal as I am. Your possibility of getting second stroke is as good as mine. Hereafter, you don't come and see me unless you want to say hello. So I was very happy. Those were soothing words. I said, well, if I am normal again, I can just go back and teach. So I did teach 4 years after the stroke. But then even though I am now retired, I have emeritus position at Ohio State University. And every Wednesday, I teach a class on drug abuse. I tell the kids not to take too much alcohol or cocaine or methamphetamine or MDMA or marijuana or opioids. So every Wednesday, I go to college still and talk to the students and convince them to be a little more knowledgeable about the drugs.
I think that's wonderful. We really need someone to stand up and advocate for good health. What led you in the direction to go into biochemistry, neuropharmacology? That's a big leap from a mud house to a doctor at a university.
Biochemistry is a very fascinating science. It tells you For example, if you are eating food, how food is digested in your body, where exactly it is digested, how does it produce your energy, how that energy you can consume for running or doing other activities. So biochemistry gives a comprehensive knowledge about your whole body, how the body is functioning. I mean, you have to know anatomy, like you have liver, you have muscles, you have bone, but then you have to also realize that you need the background in the physiology also. How does kidney look like? How does the liver look like? And then all the chemical reactions going in the body, you have to be knowledgeable to understand. I think I was fascinated because I really wanted to learn about your own body, and it came as if I'm reading the history. It's like the body is something happening in the body. I was as interested as I'm able to read a novel or something like that. And then basically, I think little at later stage, I developed interest in the brain because brain is very complex, very complex. I mean, it has about a trillion of cells. Lot of the way one cell interacts with other cell is very fascinating. There are numerous connections between one cell with the other cell. They talk to each other cell by electric impulses. These electric impulses are generated by what we call neurotransmitters. Basically, I think as one of my teachers used to say, you don't have to be great scientist to be a good scientist. What you do, just be curious. Ask yourself the question. Try to understand. If you keep asking yourself questions, then you will get the answer. And to get the answer, you may have to study or go to a scholar, to ask the question. So basically, I will say my interest developed because of curiosity. And the curiosity is there still in the brain because we are in very early stages of understanding the brain. A lot of new things will come out.
How much of our brain do you think we use, or do you know that we use? I've always felt after I had my stroke that in order to be able to, use my body again, I may not be able to use the same channels. It's like those doors are locked, but there's still other cells and places in the brain that are not being accessed. So why not try to get into that area and develop that so that you can begin to walk again or use your hand again? Now that's my own uneducated thought on it, but I'm just wondering from you, am I on the right track or am I totally out of line?
Yeah, see, I think in old days, I used to teach maybe 40 years back. I used to teach that the brain does not develop once you become adult. The neurons don't develop, the cells don't multiply. And then a few years back, about maybe 20 years back, we started understanding that brain cells do divide. It's called neuroplasticity. Neuroplasticity. What you have to do is tell the brain that we need something, and the brain will try to do new connections, new neurotransmitters, and it will help you. So this is the new thing which came in life, which is the most important. Stroke patient, the hard work comes after the stroke. You have to work hard, you have to exercise, you have to do repetitive things to help you. It's a simple thing. Unless you have other problems like diabetes or high blood pressure or some other problem, you have to take care of those problems also.
Question about neuroplasticity. When did they first start learning that this was a good
I think
technique?
the research papers started appearing about 20 years back, maybe.
I'm asking because I was in the hospital for probably 4 weeks before I was even told about neuroplasticity or made aware of neuroplasticity. But even at that point, it wasn't described to me as neuroplasticity. It was just, a nurse telling me to concentrate on moving your finger, try to move it while you're concentrating, just a vision, it moving, and it'll do. But it took 4 weeks for someone to actually bring that to my attention, and this was 11 years ago. We're in this to make sure that people know about this right away. It helps them develop so much quicker, and when they see development expeditiously at times due to neuroplasticity, it gets them more motivated, I think, to continue on, because that's exactly what happened to me. I guess it all depends on the attitude.
Yeah, I think there are 2-3 things for a stroke patient if they want a good recovery. One is that, of course, any repetitive work will help you. The exercise, doing routine things every day. Second thing is very positive attitude. You have to know that by doing, you are helping yourself. So you have to be cooperative with therapists, cooperative with healthcare workers, listen to them, do your job, keep doing. And the third thing is you take care of your other lingering problems. If you have any problem with, as I said, diabetes or hypertension or stress, try to cope up with those people. But otherwise, I think a stroke survivor can have meaningful life. It will be a slow life, but it will be fulfilling life. You may be able to enjoy life as you used to enjoy earlier. I could teach for years after my stroke. For 4 years, I was full-time employee, and I just retired because I thought that maybe a younger person can do better job than me, and I have enough pension and everything else. So I can just concentrate on teaching a small course. It is very important that we realize that we don't call ourselves a victim, but we call, as you said, ourselves as a survivor.
I think the small portion that you're talking about is a very large and important piece for stroke survivors. And I don't think people who have not had a stroke can totally comprehend what it is that we struggle with on a daily basis. And I think that's one of the reasons that I'm so excited about helping you with getting the message out. What Dr. T is interested in doing is writing a series of answers to questions that stroke survivors have. Let me just say that there are 3 areas that we will not be discussing. One is medical topics, including medical suggestions. We always want to encourage anyone with any type of medical condition to make sure that they are in touch with their physician and medical team. That's where they need to get their first round of defense so that they can begin to heal. The other thing that Dr. T said that is off limits, and for good reason, is suggestions to take particular drugs. We're not here to try to enhance or share information along those lines. The third one, which I think is a great one, because you know that there's going to be questions along these lines too, is we are not going to be resolving any family disputes. We're not Dear Abby, we're not Judge Judy, we're Dr. T, and we're going to answer questions and answers that come in from stroke survivors. So if you're struggling with something and you'd like to know what it means, I think this is where you may find those answers. So Dr. T, let's start with what you were talking about. The very first one that you had mentioned that you feel comfortable with is the biology of a stroke.
Yeah, I think there actually basically, I think it must be common knowledge that a stroke happens because of 2 things. One is a ischemic stroke, where the brain temporarily does not get oxygen in the blood. The blood flow may be occluded, it may be blocked by small clot in the blood vessel, and the blood cannot pursue all the parts of the brain. And if that happens for 1 second, you may have what we call a transient ischemic attack, where you can actually recover by yourself within minutes or within few days. Or you can have ischemic attack where you can really have problem for several years. So it depends how long the ischemic attack happens. Happens for less than a second or maybe minutes, an hour. When does it help? When you get the help. And second thing is for some reason our blood vessels get old. The blood vessels are meeting with each other in the capillaries. So sometimes the capillaries will burst and the blood will ooze out of those capillaries. And if that happens, then there will be enough blood to soak the brain and basically suffocate it. And that's the most severe type of stroke. It's called hemorrhagic stroke. And if that happens, then of course doctors try to see from where the blood is leaking, and they try to do surgery to help such patients. But sometimes, as in my case, if the blood is coming out of a very sensitive area, then the surgery can be harmful. So they had to basically see what is the risk and what are the benefits. And sometimes they may not do anything. So these are the two major strokes, and basically they tell you that you have to keep doing exercise in your body to prevent the clot. There are certain factors, sometimes they don't help in the sense that if you have congenital problem, just like in my case, they said that I had AVM in my brain when I was even baby, and that AVM in my brain could have busted at the age of 10 or at the age of 60. So I had no choice. So it happened to me when I was comfortably sitting in my chair in my office, 1 block away from the hospital. So in that way, I was lucky. But it could have happened when I'm driving a car or sitting in a toilet seat where people won't even come for 2-3 days. So it has to be some luck and all. So we have to believe in God and, thank Him for survival.
I have a question for you, doctor. I had a hemorrhagic stroke 11 years ago. When I was a young boy, there were 2 instances where I had a concussion. It wasn't diagnosed as a concussion, though, but I fell, I think I was 5 years old, and I was standing on top of a wagon, and a friend of mine pulled the wagon, and I fell backwards, and I landed on my head. And then we were leaving for vacation the next day. I seemed to be fine. My parents saw it happen. We went on vacation. While we were driving, I ended up vomiting and getting very sick. After that, I was fine. Fast forward, I was 11, I think, or 10, playing baseball in the street with my friends. I went to dive for a baseball, and I hit the side of my head on a fire hydrant and just split my head open, lost consciousness. When I awoke, I was being carried by my friend's dad, a neighbor, over to my house, who my dad then took me to the hospital, and they had to stitch me up. I guess I'm wondering if that could have had any lasting effects to where it finally manifested into my stroke some 40 years later. Any research on that?
I haven't seen anything like that. I mean, even though they say that previous injury can manifest little bit. So it's possible that your stroke may be related to injury you suffered. Maybe something happened during that time. Maybe some blood vessels become weak, which busted out. And leak the blood. It's very difficult to say, but it's also possible. Like one of my friend recently, he fell down on the concrete, and he got up, and then he didn't even notice anything. 2 months later, he went to some other city. He was walking, wobbling, not in a straight line. So his daughter noticed that why he can't walk properly. So she insisted, no, let's go to emergency room. And emergency room, they did the MRI of the brain. And they found a big hematoma. Lot of blood had coagulated. And they asked him, did you fall recently? I fell down about 2 months back in Columbus. So they connected that hematoma with the fall which happened 2 months back. So it could be that if they did not remove the hematoma could have caused some stroke, because it's all coagulated blood. It's possible, but they did not clear-cut research because these are very rare examples, and it's very difficult to know the patient's history 7 years back or 10 years back. But yeah, it's possible.
One of the other things, Dr. T, that you had said was you're comfortable talking about psychological issues of stroke. And I think that's usually an area that we really don't delve into. People have a difficult time dealing with that part of their life. What would be some of the things that you would suggest to someone who's having difficulty?
First of all, you have to stop asking God or asking anybody else, why me? What did I do wrong that I suffered from a stroke? You did not do anything wrong. The stroke just happens. The way your body is, the stroke can happen to anybody. So stop blaming why me. It's not that God is showing partiality towards you, or it's not that you did something wrong in your life that you got a stroke. So that's the first thing I would say, that this is a meaningless question. Don't ask yourself. Don't show pity on yourself. And just tell, okay, now what can I do? So now what you can do is think positive, that you are lucky to survive. Let's have a meaningful life. Try to do a good thing in your life. If you want to work, maybe see if you can work. If you want to do if you have some hobby, playing golf, maybe can you play golf? I think the ambition in the life is always helpful. Oh, I want to achieve expertise in golf. I want to achieve something in education. I want to achieve something in the business. So that drive should be there. Still drive should be there. And the third thing is that always look things at more like fulfilling. Never say somebody gave me a half glass. Always think that glass is half full, then half empty. So have satisfaction. Whatever you achieve, whatever things are happening in your life, be positive, be thankful to God, be thankful to your family who is helping you. And the next is you keep trying. You have to do exercise, you do repetitive work, you keep trying. If it is painful, then you tell your medical care that, oh, you have to do something about my pain. They will keep you pain-free. But if you are pain-free and if you are able to move the limbs a little bit, just keep trying. I remember when I got a stroke, I never used to touch my fingers because I could not touch any finger with my thumb. And now after so many years, I can touch every finger on my thumb, because I kept trying and trying and trying and trying. I could never write anything. Now I can write a small sentence. I can sign, You have to keep trying. You have to keep trying and be positive and say, okay, whatever happened is happened. But of course, the other family member should be willing to help you.
And start with baby steps. Start with the goals that are small. If you get your thumb and you can touch your first finger, that's a goal. Keep doing that and then eventually add the next finger. I think so many times we try to go from not being able to do anything to working where we look and feel accomplished like we were before we had our stroke. And we become very disillusioned because we can't do that. But we didn't start off being able to do that the first time around. So go back and just work each step so that when you accomplish one goal, you can set another one until you make it to where you want to be.
I think it takes a lot of patience. We have to be very patient with ourselves, cut ourselves some slack because we can't do it quite as well as we used to. In my case, there's a lot of things that I can still do, not as good, but I still continue to see improvement. Just keep plugging away, keep trying. Repetition, like the doctor mentioned, is great for recovery.
I could not drive. A stroke happened on my right side of the body, so my right foot cannot accelerate the car. So I had to relearn driving with my left foot. The accelerator has to be on the left side. So
yeah, I brake with my left foot.
I was thrilled, I think. And in the beginning, when I exceed more than 40 miles per hour, there used to be funny sensation in the brain. I said, what the hell is that? And but eventually it went away. It took years to went away, but it did go away. So you have to keep trying. You have to be thankful to God, be persistent, have drive, have a really deep desire to improve. And if you have deep desire to improve, you will keep working.
You would share drug information. What did you have in mind in regard to that?
I think most of the people, they don't know how the drugs work. So maybe I could talk about the mechanism of action of the drug. How does the drug work? I can talk in some cases, could it be one drug behave a certain way, and if you take simultaneously second drug, so what could be interactions? What could be drug-drug interactions, I could talk about generally how effective the drug will be. What is the research about that? So basically, it depends on the question. I won't be talking about it that you have to take one particular drug. I will say what could be, happening in your body, what drug you should take or not take it, but that you should consult your medical doctor.
Yes.
Whether drug will be effective, how soon it will be effective. Basically, I will give the idea that don't feel shy in talking to your doctor or medical provider. Whatever concern you have, you share with the doctor. And they should be able to tell you because they know their history. They know that depending on the history, what could they prescribe.
I've accepted the fact that someplace in the day I'm going to lay down and take a 20-minute nap. It's just the way things are going to be. And to tell you the truth, I'm getting to a point where I enjoy it now. I never felt like that. I mean, I always felt guilty if I took time out for myself to recharge. But maybe some of the tiredness may not be just from having a stroke. It may be because of the medication that you're taking as well. How do you try to figure out in your own mind when something like this is something that you should mention to your doctor?
Again, you have to see the history of medication. What are the side effects of the medication? Not everyone gets all the side effects, but somebody may get constipation, somebody may some other stool problem. Somebody may get some headache, somebody may get some nausea. So basically, somebody has to be concerned about what are the side effects could happen. But there is also another way. Think positive that the drug doctor has given you will help you. Just don't think, oh my God, it can produce so many side effects that I don't know what will happen. Just like when it comes to vaccines, many people get afraid, oh my God, I don't know what will happen. No, 99.999% patient will be good with the virus injection. It will produce good antibodies. It will help you in coping up with the COVID virus. So be positive, not to think about negative. So that again, psychology helps. This is something doctor is giving me to get better, and you will get better. Be aware of that some side effects that happen, something very unusual happen. Discuss with your doctor.
Doctors are beginning to recognize vitamins and the effects that vitamins and minerals have on your body. I've often wondered, how do they interact with medication? Are there certain vitamins that you can take that may reduce the effect of a medication that you're taking? Are they important to let the doctors know that you are taking vitamins?
The answer is yes. You should tell doctors what vitamins you are taking and what supplements you are taking, because there may be some interaction with those vitamins or supplements with the drug that he is giving you. The best way to get vitamins and minerals is to eat lot of fruits, lot of vegetables, whole grain. Have complete food. Don't ignore anything. Have enough water. Some maybe as we got old, we drink less and less. So drink about 6 to 8 glasses of water. The best way of vitamins is through the fruits and the vegetables and some other things. You can take vitamins. I think most of the research suggests that the vitamins will not harm. If it is like a multivitamin tablet, it will not harm you because everything is in a limited quantity. But there are certain vitamins like vitamin A, vitamin D. Those things you have to take with consultation with the doctor because those compounds can give some problem. These are called fat-soluble vitamins like vitamin A, vitamin D. But if you are talking about vitamin C, vitamin B12, B complexes, they if you take a little more, they will come out in your urine. They will go out of your body. But vitamin which are A and D, they try to storage. They will be stored in your body. They can produce some harmful effect. So those things you should take with the consultation with your doctor. I still take multivitamin tablet every day since I think 26 years I have been taking. It may not help you, but it will not harm you.
Good advice.
If you have a question,
Just send me the question also. I can answer, through email if they want.
We have a question. We can just start it off with Dr. T. I have a question, and you'll be on our page.
Dr. T is going to put the answers and the questions onto the group page, probably once a week for right now. And depending on if the interest is there and it grows, he'll do it as often as need be. If you're not sure who he is, he will have a title on there that says he is an expert. We give them to people who have been trained in their particular field so that you know that if you ask them questions or if you follow them, you can be assured that they have the education to actually be able to help you and not just give a personal opinion.
Forward it to me at Gopi Tejwani at gmail.com. And the rest is about the drug information and the stroke information. Those are neuroplasticity. They are like a technical questions, and I will see what is the current research and try to give the correct reply.
So I think what you're offering also is a great help for the family members as well, to help them to understand maybe we are going to be a little slower in what we do, but just give us the time and we'll show that we can still do them. Or maybe we need a little more inspiration from you or a little more direction from somebody in the family to help us through on something. Hopefully by what you're doing here, it's going to help families to come together more and work and realize that what they're going through is just a normal phase of the recovery process.
I love the points that you make about staying positive and keeping your head up, working hard. That's what got Sharon and I through my stroke. We stayed positive. We still cracked jokes with the nursing staff. We enjoyed the time there and enjoyed the people that helped us.
I have heard many people say that after the stroke, I lost my friends. I am not welcomed by my friends anymore. So I suggest to those people that try to be as good to your friends as you were before a stroke. Try to be as normal as you were before the stroke. And your friends won't abandon you. And if there's a problem about movement, about lifting heavy things, just express your result. I can pick it up or I cannot pick it up. So they will help you.
What I struggle with, I guess, is conversation with a group of folks or conversation on a phone where the person on the phone has no idea that I've had a stroke and they're talking pretty fast. So I have absolutely no problem telling them, please bear with me. I had a stroke, but it's still hard for me to comprehend what you're telling me. So if you don't mind, just talk a little bit slower. And they do.
I do the same thing. Right away tell you that I am a little disabled. I had a stroke. So please go slow. I said, yes, I can write, but you have to dictate me very slow because I'm very slow and write. Don't feel shy in telling who you are.
I have to give the credit to my wife on that because she convinced me not to be ashamed to tell somebody.
What is there to be ashamed?
Yeah.
I mean, we did not do anything.
Yeah.
God has given us something. We never said, oh, I mean, there is nothing to be ashamed of.
I often wonder why when I ask people to speak a little more slowly because I have difficulty writing that quickly or comprehending. Why is it that they also talk louder?
That's right, yeah. No, we have to educate people. That's our responsibility also.
When I do it, I feel a sense of joy because you almost see a light go on within that person. We can, help them to understand. Hopefully we've done something good. I want to thank you again for being here. It's our pleasure. Both Bob and I are honored to have you here.
That was a great show. Great interview, Doctor.
Yeah, I think you are welcome, and the last thing I want to say that all the stroke survivors, let's communicate with each other, let's help each other, let's try to share our grief, our joy, our knowledge.
Right.
It will help everybody, including myself. Okay.
Thank you so much.
Okay, thanks.
Thank you, Doctor.
Okay, sure.
Just remember, everybody, don't count us out. God bless. Have a great day. Bye-bye.